today, I'm going to perform on how to administer topical medication. So first, we need to gather all the equipment like the medication tray, gauze pad, gloves, kidney basin, and clean water. And then next, we need to check medication order against the original physician order according to agency policy. We need also to clarify any inconsistencies and check physician's chart for allergies. So we must also know the action, special nursing consideration, safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. So we must also consider the appropriateness of the medication for the patient. And then next, we need to perform hand hygiene. And then prepare medication for one patient at a time. Read the MAR and select the proper medication from patient medication drawer or unit stock. So, compare the label with the MAR, check expiration dates, and perform calculating if necessary. So, the expiration date are still valid. And then next, when all medication for one patient, have been prepared, recheck the label with the MAR before taking them to the patient. And then return the medication stock to patient's drawer. And then transport the medication to the patient bedside carefully and keep the medication in sight at all times. So, ensure that the patient receive the medication at the correct time. So, next, identify the patient. Usually, the patient should be identified using two methods. Compare information with the MAR. So, good morning, sir. I'm Crystal Jane Manuel, your student nurse for today, and you are?
Sir Paul Manuel.
And we can also check the identification band. So, if the patient cannot identify him or herself, verify identification to the significant others. And then next, complete necessary assessment before administering medication. Check bracelet or ask patient about allergies. So, sir, do you have any allergies to any medication?
No.
How about foods?
No.
Okay. And then explain the purpose and action of each medication to the patient and then perform hand hygiene. And then put on gloves. Use non-sterile glove unless the skin is broken. If the skin is broken, use sterile gloves. Next, wash, rinse, and dry the affected area with water and clean gauze. Can you move your hands, sir? Thank you. And then change glove and discard derm and perform hand hygiene. And then next, place required amount of medication using a cotton tip applicator. Note that the cotton tip applicator is sterile and is for single use. So let the patient know that the initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. So, observe signs of irritation or redness. And then next, remove your gloves and then perform hand hygiene. And then next, document the findings. So that's all for topical medication.